Month of May is National Stroke Awareness Month, and in Eye on Health, Latrice Curry talks with a doctor about some of the warning signs and what you can do to prevent a stroke.
When it comes to stroke, time is brain.
Stroke is the #1 cause of adult disability in the United States and throughout the entire world.
Dr. Thomas Devlin is the director of the CHI Memorial Stroke and Neuroscience Center. When it comes to stroke, the American Heart Association wants you to remember the acronym FAST.
Face, arm, or speech problems. If you have any of those, what do? That's when you think about T, and the T is to remind you that time is of the essence.
Unfortunately, Tennessee, Georgia, and Alabama are all part of what's known as the stroke belt.
We have about the highest incidence of stroke anywhere in the United States.
This is why Dr. Devlin wants to stress it's easier to prevent a stroke rather than to take care of yourself after having one.
80% of strokes are completely preventable if people just take the time and do what they need to do not to have a stroke.
#1 on the list is knowing your numbers, especially when it comes to your blood pressure.
Blood pressure is tremendously important. 130/80, and they really would like to see it ideally 120/80 or less.
Dr. Devlin says about 50% of adults are considered to have high blood pressure, but you can start to reverse those numbers by making lifestyle changes.
Exercise regularly. Watch your weight. If you're overweight, work on getting your weight down. If you have diabetes, get your diabetes under tight control. Smoking is a gigantic problem.
Dr. Devlin says some other warning signs include sleep apnea and an irregular heartbeat.